สวัสดีค่ะ Thank you, Dr. Prin, and good afternoon, everyone. As Dr. Ihara just talked about the glaucoma surgery, and if you deal with glaucoma patients a lot, you can understand that why patients choose to use the eye drop instead of the surgery. And of course, in terms of ourselves as a surgeon, we also normally choose the medication instead of the surgery because surgery still not satisfying us as the glaucoma, as the cataract surgery. So, eye drops always the winner. The problem is the eye drops, especially is the long-term or lifetime use of anti-glaucoma medication, it can cause the ocular surface disease. So, preservative and also the major ingredients of itself can cause a problem to our cornea, the intimate of our cornea. So if you see anti-glaucoma medication that we have using right now, there's no preservative-free in the market. And also there's some medication that try to sneak out of the BAK as a preservative, but we also have very little in mind that we can choose. Why preservative? Why not preservative-free? Because we all know that preservative can prevent the infection, can maintain the eye drop qualities, and prolong the usage of that eye drop itself, and also enhance the ocular penetration. So, if we use the preservative for a long period of time, why we still use the BAK? Of course, as we all know. But if we still have the BAK that is at least concentration, it may be a better choice. So let's see, is this medication can give you any more solution for your glaucoma patients or not? The BAK have excellent antimicrobial efficacy. It enhances aqueous drug level, and it has been known in the market and also by us for a long period of time. So when we use the BAK in very least concentration, somebody gonna ask me, or I myself ask the industry, that is the efficacy still the same? Is the medication still enhanced by the aqueous drug level as we expected? So the eye pressure or the intraocular pressure lowering efficacy is still the same or not? And also another important question is that, is the antimicrobial efficacy is still effective? So let's see. The BAK itself, of course, if it's higher concentration, it will cause more damage to the cornea. The higher concentration, the more effect or the more harm to the cornea by itself. So this one, the new medication, it can give you very least concentration of the BAK, but there are pros and cons of those, right? Preservative can unstable of the tear film, it reduces the tear breakup time, it causes the hyperemia by itself, it causes the apoptosis and also the capsule problem. The BAK toxicity can cause even just only 2 weeks after you use the anti-glaucoma medication continuously. It can affect the palpebral and bulbar conjunctiva, its reduction of the goblet cells, increased keratinization, increased the squamous cells metaplasia, and also loss of microvilli, and increase the fibrosis of the subepithelial. This medication, the tafloprost, which have a concentration of the major ingredient only 15 micron, 15 microgram, and the prostaglandin itself is the F2 alpha analog, which is the eye drop that you can use, we expect that we can use every day without any problem. The prostaglandin has been now accepted as the first-line medication by many protocols or many guidelines. The prostaglandin we have been using in the market is the latanoprost, the mimattoprost, and travoprost. They all have BAK as a preservative. The travoprost tried to change from the BAK to the polyquat. The polyquat itself still the preservative, which is in the same group of the BAK. Of course, it's not BAK. It can call BAK-free, but it still have preservative. The new one, the medication, the taflotan or the tafloprost, is the concentration of the tafloprost around 15 microgram, and have very least concentration of the BAK. It's just only 10 microgram of BAK compared to the others in the market. So let's see, is this BAK good or bad? This prostaglandin why it can maintain just only very minor or very tiny ingredients of the major one is because the carbonic acid form of the PT itself, it promotes the extracellular matrix, the metalloproteinase with the FP receptors, and it can change the uveoscleral gap and increase the aqueous outflow by the uveoscleral pathway and lowering the intraocular pressure. What is the unmet need of your prostaglandin right now, or anti-glaucoma medication right now, is that some medication you cannot store in the room temperature. This one, it can be stored in not more than 30 degrees Celsius. So even this medication in Thailand, I also recommend patients to store it in the refrigerator anyway. The unopened one, they're supposed to be in the fridge. The open one you can carry on, but it's not supposed to be exposed to direct sunlight. And this medication can have the higher affinity to the FP receptors. It used the th1 as a receptor for the BAK itself. So it can increase the affinity, which I will talk later on. And also this medication, because it's a prostaglandin, it has a very low adverse drug reaction. And the packaging of if you're familiar with the Santen family, you can see that the packaging is almost the same in every bottle. It just changed the color of the cap, which there is something that I'm aware as well. In many of our glaucoma patients who could not define the color that much, so it probably has a confusion to the patient to use the medication by itself. So it's probably color is probably not a good idea for me for the glaucoma patients. But the packaging of the taflotan or the Santen of all the family, when you squeeze the drop, it's easily squeezed. And if you try drop it continuously, you can see that it can control the quality of the drop quite good, which means that you can use this bottle like a month with the same amount of the drop in every single drop that you use, which is maybe good. Also, another one that is changed from the other prostaglandin is that the difluoride chemical, form of it. The difluoride effect caused the FP receptor, which has a strong intraocular pressure lowering effect. And it also improves the pharmacokinetics of the medication. It can prolong the action of the medication. It claims itself that it increased the ocular blood flow. And it can store at the room temperature, which is below 30, which is, remember, Thailand is always higher than 30 degrees Celsius. And if we compare with the others, prostaglandin that we have been using, the affinity of the tafloplast seems to have higher affinity with the FP receptors compared to the other in the market. Also, the one that I'm quite happy with this product is that the BAK concentration is the least.